Can you tell me what Moorfields are doing to treat patients at the moment?
We're continuing to offer traditional face-to-face services. Through the pandemic, we've had to reduce the number of those to support social distancing. That's driven a big push towards new ways of seeing patients remotely. We're doing telephone consultations like all other trusts are, but our big area of growth has been in video consultations. We went from providing no video consultations between patients and doctors at the start of March. We've now done well over 10,000 video consultations.
How does it work in terms of waiting list? Do the practitioners call the patients? Is it you will get a call at this kind of time, or is it a queue? How do you manage that?
So we've got two different kinds of services. We have our emergency services that offer video consultations, and we have the booked services. Now, the emergency service run from our accident and emergency department, that operates a lot like a virtual accident and emergency. So patients don't need a referral. They go to our website and they will find under the emergency care bit and under the video consultation part of the website, they'll find a little link which they can click on to basically enter the virtual A&E. They speak to a virtual receptionist who's a member of staff, often working from home. They book them onto the system and then pass them on to a doctor. Call times, sort of waiting times for a call, well under 10 minutes typically. So patients getting really quick care in that drop-in service. The other ones are our routine services. I run a scheduled service. Patients are sent an information leaflet. It's got a link on which they follow, or they can follow a link from the Moorfields website. They enter a little bit of data about themselves, so their name and a backup telephone number if needed. And then on my web browser, they pop up on a little list, and I simply work through from the top. So whichever patient is there, I load up their notes on the electronic medical record. I see the patient by video, and then I go on to the next patient on the list.
How do you find patients have found it?
It's extremely positive, well over 90% satisfaction rate. The vast majority of patients either strongly recommending or saying they recommend it to someone else.
In terms of you as a clinician and I guess your other practitioners, how are you feeling about the standard of clinical care that you're able to deliver? Do you feel it's up to your usual standard, or do you feel you're compromising at all?
I think it's important to bear in mind that they are definitely a different thing from a face-to-face consultation. You can do different things with them. So I certainly wouldn't suggest that a video consultation can achieve the same results as a face-to-face consultation in certain circumstances. So it's a matter of saying, what are the use cases for this? Now, that may be through patient selection. So when I've gone through my list of patients who are waiting to be seen with my colleagues, we try and identify those patients who we think we could manage by video consultation. So let's suppose, for example, a patient typically has problems with allergic conjunctivitis around this time of year. That's a suitable patient to see by video consultation, because we could then organize their treatment to increase or reassure them if it's all going well. I've seen some patients who've had an orthoptic assessment just prior to shutdown, who I was able then to list for squint surgery, for example. So patient selection can mean that we do consultations that are really useful. If you look at the A&E example as well, what's been really great there. So Gordon Hay, who leads our A&E, he has set up a virtual triage system in A&E, which is what I just described. The patient clicks on the website and comes through. Now, we find that we manage about 78% of patients who come through that system at home, by reassurance, by directing them to pick up a prescription from their GP. And the remaining 22% of patients we bring in for face-to-face.
Were there any teething problems at the start? I mean, how long did it take before everyone got into the flow of it?
I got to say, there were teething problems, no questions about it. There were many fewer than I expected. I thought it was going to be a lot harder than it was. And part of that was the technology, which was pretty simple, all browser-based, works pretty well. And the enthusiasm of clinicians, the clinicians who do it, and we've got over 150, I think, onboarded onto the platform, enthusiastic about offering and sort of made it work. But yeah, there were some teething problems. So if we look at the platform itself, that went from quite a small platform to being nationally procured by NHS England and dealing with 10,000 video consults a day across the country. So there were a couple of technical issues in the early stage, occasional outages. That's improved a lot, and I think the company who provides it, Attend Anywhere, is doing a great job in keeping the uptime really good now. Initially, the approach was to put a menu of services on the website. So the patient would come along at their appointment time, go to the website and say, right, I need to go to Mr. Thomas's pediatric clinic. I'll find him in the list and I'll go into that waiting room. We found that there was quite a high rate of patients ending up in the wrong waiting room by doing that. So we relatively quickly moved to a virtual receptionist system, which I think I touched on earlier. which is where one of our administrators sees the patient first. And that reduces these 50 different points of access to different waiting rooms down to 2. One virtual reception desk for emergencies and one for booked appointments. And then you get someone, the first person the patient speaks to can log them onto our system, work out what the correct waiting room for them to go into is, check that the technology is working okay, and then pass them on to the clinician. And I'd say that was probably the biggest improvement we made. And when I talk about this to other hospitals and other clinicians, it's usually saying, really do consider virtual receptionists. It's an extra person in the chain, but it really pays its way back in patient experience and in clinician experience, because I now know that everyone who's in my waiting room is meant to be there and that their microphone works. So that's great.
And so just from your practice of doing pediatric care, how is it, I mean, it's always tricky getting children to focus. Is it harder when you've got a screen between you?
Depends on the age. So you find children up to a certain age will always, grab for the phone, and then you suddenly find that the device is moving towards the child's mouth. So there are some new challenges that come along with this. It's probably a very good way of examining teeth, but listen, it really depends on the child. Sometimes you just get brilliantly compliant children. You can get the parents doing a bit of a cover test for you. I found being able to make reasonable estimates about squints that are there. Importantly, able to, quite often make sure they've got full abduction, shall we say. And if we look at the strabismus population in adults, it's a really good way of telling someone, finding out whether a third nerve palsy is resolved, for example. So it's a matter of patient selection. So I try and select those patients where it's mainly history that's important, or those patients where I feel a look at the eye movements will tell me what I need to know in order to determine what the next step of treatment is. It's working better than I would have expected.
And so what do you think comes next?
What I'd really like to come out of this would be really good digital connections between optometry and hospitals. I think where the meat of this is shared care, and you can't do shared care safely unless the optometrist on the high street or wherever is able to access what's been happening in the hospital, able to access the baseline imaging, and have really good two-way communication whenever you want. And that needs some solid digital infrastructure.